American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and United States governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. So we have the usual Zoom housekeeping stuff. We'll ask you to stay muted during this time. Please put any questions and comments in the chat. We will be monitoring those questions and keeping track of them. There will be some time at the end of Delilah's presentation for questions. We will be recording this presentation, so it is up to you if you want your camera on or off, whatever you're most comfortable with. We will be raffling off a free year of membership with the Minnesota Public Health Association. So woohoo, more opportunities to engage with MPHA and our committees and our events. We do have events that sometimes are members only. So we'll be sharing that link. It's to a Google form, and you can fill that out at any point. And with that, I'm going to give the time to Delilah. So Delilah Robb is a member of the Turtle Mountain Band of Chippewa Indians. Her pronouns are she, her, hers. Delilah is in her first year of graduate school at the University of Minnesota School of Public Health in the Maternal and Child Health program. She also works at the Indian Health Board of Minneapolis as a community health educator. Delilah develops and delivers sexual health education for American Indian community members of all ages. And with that, I'm going to turn it over to you, Delilah.
Thank you, Ellen, for that great introduction. I really appreciate your land acknowledgement at the beginning. I think that's really important. I'm going to just get started. We have a lot of information to cover. Can everybody see the presentation? Good to go. Okay.
Yes.
So I'm going to talk to you guys today about the American Indian listening sessions, which help develop some sexual health messaging. So like she said, I'm a member of the Turtle Mountain Band of Chippewa Indians. Here's my contact information. If you have questions or comments afterwards. Also, I started my graduate program over the summer. I hope to graduate in class of 22. So today we're going to talk about the listening sessions. There's a lot of information with the listening sessions, a lot of logistics. And then I'm also going to share a little bit of the findings. I won't be able to go through all of the findings, but the findings are public, and I put a link to that in the chat. So that'll bring you to the PDF. I'll talk about the development of the sexual health videos. I'll also, hold on a second, please. There we go. So I'll also talk about the community member interviews and how that was used in the filming of the videos. So upon registering, I really wanted people to watch the videos before they join the webinar. And part of the reason is the videos are both 5 minutes long, and they kind of take, like I don't have time to share because there's so much work that was put around the logistics of developing the videos. That is really, I think, some of that work where nobody showed me, you know, it was like I had to figure out how to do this, and it was a lot of work, and I'm really proud of what was developed. So I'm going to talk a little bit about that, and I'll share about the dissemination of the videos. So this work is funded under the Family Planning Special Projects out of the Minnesota Department of Health. We are one of the new grantees, and we got funding in 2000, I believe it was 2018. So we're beginning year 2018-19 was our first fiscal year. So we're starting year 3. And part of my main goal as a sex educator is to lower American Indian STD rates in unplanned pregnancy. So also as part of the pre-material to review, I talk a lot about I share some of the disparities with American Indians in regards to STD rates and unplanned pregnancy in Minnesota. So I really think it's important that we think about those before we begin. Also, I sent out a PowerPoint presentation about social determinants of health that American Indian people experience, and I think that they're really important. And as an American Indian person myself, I think that a lot of those social determinants of health, I see them every day. You know, I see them in my community, I see them in my family. They're extremely important. So that's one of the reasons why I sent out that presentation, is because a lot of the times people need to be caught up or get up to speed before they can really understand where we're at. So I want to lower STD rates and unplanned pregnancy. And how do we do that? So I do that through education. I educate in a summer program the last 2 summers. I have a parent group, a youth group. So I do in-house education. And then I also work with just groups throughout the community. So mom groups, treatment groups, youth groups, cultural groups. My services are available, and my primary audience is American Indian people in the Minneapolis area. So we have been able to open it up a little bit with virtual learning, so to maybe other communities in Minnesota. And then increase STD testing. So I think that that's really important. So creating an environment where people feel comfortable getting STD testing and aren't afraid to come into the clinic. Increase birth control use. So that is really a sensitive matter for American Indian people. There has been a long history of reproductive abuse of American Indian women. And that has been like the forced sterilization of American Indian women, and also, you know, sterilizing American Indian women against their like knowledge. So them not knowing that that is happening, where they say they do one procedure and then they sterilize. And then also the testing of birth control on American Indian women. So part of this is like, how do we get people to come in and get tested and use birth control? And it's through destigmatizing conversations about sexual health. So getting people more comfortable with talking with their parents, their partners, their family. And then also a big goal of mine in all the work I do is, how do we incorporate our cultural teachings into the work we do? And I think that this is a really interesting topic, and I hope to explore it more. A lot of the lessons and teachings happen through storytelling. So I think that that's one way that we can incorporate cultural teachings, but also thinking about just providing space for cultural activities. And that is like, I teach beading well. I allow students to bead while I teach sometimes, depending on the group. And then also putting time aside to do those cultural activities at the end of my education. So in my summer youth group, what I'll do is I'll teach for an hour and a half, and then I'll designate another hour to cultural activities. And a lot of the times I'll invite cultural speakers to share stories. And it's not just youth who want these stories, it's adults too. And that's because of assimilation and the loss of our cultural identity, which has a long history. So that is a whole nother presentation. But I'm going to talk a little bit about the videos. So our main objective of the videos in the campaign, and what kind of led us into this listening session, was the gathering of community input to develop these sexual health videos. And then also it was like identifying our gaps in our healthcare services, and what services can be implemented to ease access and destigmatize and increase the STD testing, and also increase access to birth control. So these bullet points here are part of, you know, this main overarching goal of all the work I do. So how can we use what we learned in the listening sessions to inform our programming and help improve health outcomes for American Indian people? So so as part of our grant objective, we had it written out, you know, when we applied for the grant, that we would create these videos. And part of it is that we were going to hire one cultural consultant and get input about the development of the video from there. And I really wanted to get a more broad community opinion about sexual health, especially youth, because they're like our audience that we're trying to target, but also parents. So, you know, and there were elders who participated in the listening session. So getting more input throughout the community rather than just from one community elder. So we went into this like planning and development phase of the listening session. So I was like, let's do these listening sessions and figure out what we can learn from the community to help us like improve our programming and develop these videos. So I was very lucky to have met Lisa and Emily from Better Together Hennepin and Khadijah Cooper from the Annex Teen Clinic. Lisa and Emily from Better Together Hennepin had done some listening session with systems youth, so youth that were in the system. So they had done listening sessions, I think in 2018, the beginning maybe, and they had said, yeah, we'll help you get started. And I had mentioned in a meeting the task that was kind of like ahead of me. So they came and helped us. I'm going to talk a little bit about the question development and then kind of the logistics of the listening session. So there's just a few different parts of this planning and development that I'm going to share. So we developed these overarching questions and the purpose. So what do American Indian people need to help them prevent STIs and unplanned pregnancy? And the purpose of the listening sessions is to identify influences, beliefs, values, traditions, or knowledge that prevent or promote youth from access to sexual health services, to identify barriers to accessing these services, and to identify actions to destigmatizing the sexual health care services. I felt like we spent some time really thinking about, well, what do we want to ask in these listening sessions? And I think we first went into this like brainstorm kind of phase where me and my supervisor, Lois, we really started thinking about, well, what do we want to know? What is our main goal here? So it really started with all these questions. So we really took a good, like, we both just wrote down all these questions that we wanted, and then we started refining them. And that is how we got these questions. So you can see that these questions are embedded in this list of brainstorming activities. So, or brainstorming questions, excuse me. So we really just started to narrow it down from here and being like, okay, what do we want to know? So we kind of got our questions worked out. And then also, I think it's important to mention that I didn't really, I thought, well, we could put people in a room and just ask them questions, but how is that going to create an engaging environment for sharing? So I think that is where Khadijah Cooper from Annex Teen Clinic came in and helped us really think about some interactive group discussions or interactive activities where it wasn't like, okay, let's just ask you questions and see what happens. We really started developing activities to help us do that. So I want to talk about those activities, but first I'm going to move into this. So we went into this pilot session. So I think the pilot session was really important because it really helped us iron out a lot of the kinks or things that we didn't think was working. So we recruited, I think it was a really small group. I think it was only 7, but we kind of recruited 10. And we did have like parent permission because these youth are underage. So this work started a year ago. October 1st, we held our first pilot listening session at the Division of Indian Work. We recruited self-identifying American Indians age 13 to 19. We provided a meal and a $30 gift card, and we really wanted to test out the activities and the logistics and the questions and our facilitation. And we also had 2 note takers. We did not record the sessions, and we had 2 IHB staff take notes. And And I will say that they even learn, I think that having them there and them knowing kind of what I needed for them and needed from them was helpful too. So it was kind of like this test run. And I did want to show you guys just the schedule really quickly because there's a lot here, but we really planned everything out by time. So, you know, we would arrive, we would serve dinner, do this introduction and overview. We also started with like a group agreement, and a lot of sex educators and other educators will know that it's good to start with like a group agreement because just kind of laying down some ground rules to get people to know like this is a space where you need to be respectful. And then also I did an overview of the circles of sexuality, which I think is really important because sometimes when people think about sex or sexuality, they just think about the biological aspect or the reproductive part of sexuality. And it's really a lot broader than that. So we went into these like small group activities. So these are the questions we asked. We had small groups of like 2 people. Then we had this like parent share where you work with your partner next to you and then report back to the group. Then the snowball fight where basically you would write your answer on a piece of paper, throw it in the middle of the room, and then you would pick up a random piece and read it. So it'd be more anonymous that way. And then we had a merry-go-round, so people going from one large post-it around the room to the next. And then at the end, we had this like debrief where we talked about what are the things that you liked or what was missing, what you didn't like. And then at the end, we did like the gift card sign out. So, and you can also see on the far right hand, we had it assigned. So we knew who was going to say what, and we had it all worked out. And I'm going to talk about the lessons that we learned through the pilot session because I think they're extremely important. There was a point where I think that we started talking here at IHB about, you know, we're not really centering American Indian voices, and it felt like we were so kind of like focused on the activities and getting things done and the schedule that I think that the Indigenous part of it got lost. So it was really important for us to indigenize these listening sessions. So we started thinking about like, how do we do that? And even as a Native person, like it's important for me to think about how I can create an environment that is conducive to sharing for our community. So one of the first things that I'm going to say is that we really felt like it needed to be Native led. So that means that we kind of really wanted the first session, I didn't even participate in the facilitation very much. I did the introduction, closing, but I didn't do any of the facilitation of the activities. And part of that is like, it's always nice to have somebody like overseeing kind of what is going on, because there's a lot going on in that space. So we kind of felt like we needed to focus my voice and Lois's voice. And Lois is my supervisor. She's also a Leech Lake enrolled member of the Leech Lake tribe. So we kind of wanted to focus that a little bit more. And although Khadijah is great, a lot of people recognize me in my community and know that like I'm doing this work. So I think that it really did make sense. We also wanted to open up with a prayer. So I am not sure if you all are familiar, but it's not uncommon for us to ask like an elder or somebody else to like start open with a prayer or a drum song at the beginning. So we started out with that prayer. And this is really important, actually, the tobacco offering and the smudge. So a smudge is like using sage or a smoke cleansing to start out. So usually that'll be done with the prayer. Also, there is like this tobacco offering. So one of the things that I thought was really important, and I worked with Carly Fellner, who is a psychologist. She's a First Nation psychologist. And I worked with her. She had done an internship at IHB, and she just so happened to be at the clinic. And somebody's like, you should talk to her. She'll help you like indigenize these sessions. She knows a lot about indigenous methodologies and research methodologies. So I met with her, and she gave me some tips. And part of the things that she reminded me is that the way tobacco is used in
I am listening to a webinar, but I'm off of it. Second shit show.
And part of that is, excuse me. So the tobacco offering is that you offer somebody a gift when they're sharing, when they're doing something for you. So say you're asking them to help you with something. So part of it is that we're honoring the community members who are participating in these listening sessions, and asking them to help because they have knowledge that I don't have, and that I'm asking them to share. And part of it is that sexual health is very sensitive, and it's also just recognizing that, you know, respecting them and recognizing their knowledge. So we also did a food offering, which something that kind of goes around with that prayer and the tobacco offering and the smudge. So we did a food offering. We also, at the beginning, I started with an introduction to how there's a lot of historical or intergenerational trauma around sexual health, and that there was a lot of sexual abuse in the boarding schools, and that this isn't far removed from this community. This community, some of them have gone to kind of Catholic schools or boarding schools, especially like in the parent session. So I had 2 sessions. It wasn't just the youth, it was a parent elder listening session. So just recognizing that and acknowledging that, I think was really helpful. And it also just allowed people to know that like it is hard to talk about this. If you're having trouble, it's okay. And I would never force anybody to participate in the listening sessions, share something that they didn't want. But I also say that in all my classes too, where I really recognize that like you're having a hard time, that you need to take care of yourself first. And then I also make sure to provide resources. So we have a counseling and support. We have a staff of psychologists here at IHB, and I always make sure that anybody in any of my education is aware of that, because there is a lot of processing and healing still happening in this community. And then at the end, we did a talking circle. So that is just a shared space where we are able to like process kind of like the session. And then the language. So just being able to frame the way that we talk about like these listening sessions, calling them knowledge holders, you know, calling our meaning making session where we kind of reviewed and summarized what we learned. So just changing the way that we talk about, you know, what we learned, you know, rather than saying, oh, participants, oh, just calling them knowledge holders, giving them a little bit more respect, using native terminology to talk about what we're doing. And that's helpful. That's helpful for the people in the session. It's helpful for me. I think it really allows me to be more connected to this work, connected to the community. And I will say that if you're trying to do work with the American Indian community and you don't know how to do any of these things and you're thinking about it, you need to find a Native American community elder to help you do these, or community member who's connected to the community to do this. And if you don't know anybody and you're doing this work in the American Indian community, I think you need to reevaluate your relationship with that community and the purpose of that work. I think it's really important when you do community work with any community that you are building relationships with them, and because that is building trust. And I think if you take the time to do that with any community, you're going to find somebody who is going to recognize that you're coming in like an honest, humble way and will be willing to help you do this. So there's a lot of different ways to go about this, but I think that some of this stuff you know, you need to take the time to build that relationship and understand that community, and then also understand the practices that they use. So I just briefly wanted to talk about the listening session kind of recruitment flyer. I mean, looking at this, I kind of mimicked what Better Together Hennepin did to recruit for their listening sessions. But one thing I will say is I don't think, I wanted to like make it as brief and concise as possible, but there was still kind of confusion, I think, about the term listening session. I think that we should have called it a talking circle in a way, but in a way it's not a talking circle because it's so interactive. So, but a community member had said, oh yeah, I'll come and listen, you know, and I was like, oh no, we're gonna listen to you. So there was a little confusion about that, but I think it was fine once they kind of came and we talked about what we needed, what we needed and wanted from the listening session. So if I would have went back, I would have probably maybe added some pictures on here and maybe kind of tried to summarize it a little bit better. And maybe that community member just didn't read it in detail because there's so much on here, you know, maybe that was part of it where it was like overwhelming. So, but this, I just wanted to show this. Here's the back of it. We also had talked about like, are you American Indian? A lot of the times they must have identified as an American Indian person. A lot of the times people there's a lot of controversy around blood quantum, and that's how you identify with your tribe. So we really wanted people to know that, like, no matter what your blood quantum is if you identify as an American Indian, you are welcome to join. Because sometimes people identify or their family is American Indian, but they're not enrolled. And we wanted people to know if there were descendants, if they weren't enrollable for some reason, because sometimes your parents come from two different tribes and it gets really complicated. So I'm not going to go into all that, but I just wanted to show you the kind of application. So we have the youth and parent elder. So we extended this outside of just parents because we have a lot of grandparents and elders who are doing a lot of caregiving to youth. So that's really important that you have to think about that, because there's a lot of grandparents caring for their grandchildren in our community. So we recruited through our patients. So people who came into the clinic, we recruited that way. We recruited through Facebook, different Facebook groups. We recruited through the University of Minnesota Indigenous Studies listserv. So this listserv is pretty well used throughout the Minnesota American Indian community and Minneapolis. So I always share the things that I'm doing on that listserv because community members are on it, but also people, professionals like myself who are doing community groups, have community events, and then bulletin boards. So bulletin boards are widely used throughout our community, which has been kind of sad through COVID that we haven't been able to, like, people just aren't going to places anymore. So we're having to like kind of think of new ways to recruit for our programming. So we had a 3-hour session and you must attend the full session. So we weren't kind of letting late admittance. And then youth age 13 to 19. And then we had caregivers who were taking care of 11 to 17-year-olds. So parent elders who were caring for 11 to 17-year-olds. We had a meal provided and a $50 gift card incentive. The sessions were held at the Minnesota Indian Women's Resource Center. So we really thought it was important that we had the listening sessions in our community and that people knew where to go. So it's right across the street from the Indian Health Board. If those of you who do not know where that is, it's in South Minneapolis, kind of by the Franklin, Bloomington, the Avenue. So, and then we had 4 IHB staff members who were we had two facilitators, Lois and I, and then we had two note takers who, one was a health program support tech, Brittany, and then Liz, who was a health educator. So we had them come in. And this is kind of the agenda of what we did. It was, you know, when you look at it, it was 4 hours. And then we had the arrival, the dinner, we had our introduction, acknowledgement, all those things that I showed you in that indigenize was kind of there in this, the opening part. Then we had the main activities, and then we closed with the talking circle. So I really just wanted to show you kind of like, we really did have this really mapped out and planned, and I think it was very helpful for us to be organized. So this is the beginning. You can see in the overview, we also did like an icebreaker. So this icebreaker was really fun, where we learned each other's names. We took 10 minutes out and played a game. And during the game, I got this from a curriculum that I use called Respecting the Circle of Life, which is a American Indian specific sex ed curriculum developed by Johns Hopkins. So, but there's this activity at the beginning where you play catch, and you say your clan or your favorite animal at the beginning, and then you learn everybody's name. So you kind of have to say their name when you play catch, and that's another way that we kind of indigenize the session. We had our group agreement, we talked about circles of sexuality, and then we did this sticker vote where we had people vote on, I highlighted the questions on here that we ended up asking, because I think that people would be interested in what we really ended up asking. Also I put in the chat the listening session summary. So if you're interested in learning more about the findings, I just wanted to show you that. So here's some other activities: our small group, our merry-go-round, our snowball fight, our parent share. And then the last part I just wanted to mention is that I found 3 PSA videos. They were very short, 3 to 5 minutes long. I showed them to both groups, and these are like, we asked them what they like about them, what they didn't like, what wasn't, if they knew the message, did they trust it, would they be motivated to get sexual health care services. So this is kind of the outline of our schedule, which I think it was just so helpful for us. Then you can see on the right, like, we have like who is going to say what, who's going to lead what activity. So then this is where we get into like our meaning making session, where we synthesized our data, and that we had, I think, 3 2-hour sessions where all we did was talk about each question, looked at our notes. And this is what it ended up, some of our big post-its ended up looking like. So what we ended up doing is the 4 of us, so my supervisor Lois, who helped facilitate, and our 2 note takers who are IHB staff, this is called, I think it's called IDEO, human-centered design. So which is really friendly to American Indian community, because it allows everybody to have a say in what was the main message. So what we did is we went through each question, and we wrote down the things that stood out to us, and also looked at the notes. Maybe somebody said something specific that stood out. So we just started writing our protest on our post-its and slapping them on here. And then we started organizing them based on themes. And if you see, like, in the dark red on the left, the dark red handwriting, and the permanent marker on the right, you can start, after we had grouped them together, we started developing themes. So things that stood out to us. And then I took all these post-its and wrote a report. So the original report is about 10 pages long, where I captured everything on here. And then I summarized that into like a 4-page document, where it was like the summary of our findings. And that is what is in the chat. So this is the community listening session findings. So the UIHI, the Urban Indian Health Institute in Seattle, they really helped me put this together. Sometimes when you work for nonprofits, it's really hard just to even get to spending the time to develop things that look pretty and look nice, because a lot of times you don't have a graphic designer at your kind of beck and call. And even though this isn't like so fancy, it's nice. They were able to help me, and they just kind of, I gave them a Word document, and they kind of put it together for me. So just a little bit about the summary of findings. What beliefs do you and your family and tribe have about sexual health? So a lot of the youth realized that they want their youth to be safe, and that the youth knew that. They also felt like there was not enough communication. We got a lot of like sex readiness, kind of like, when is the right time to be ready for this? We got some questions regarding that. Like, they wanted them to be ready. When is there a time to be ready? And then we, in both groups, we also found, like, heard comments that some fear-based teaching around sexual health, which is not uncommon. That is very westernized approach, where, you know, in mainstream kind of deal with that too. So some of those fear-based teachings or values. And then some things that they wanted to hear was, like, we got some questions, like there was on some of the post-its, and we didn't know exactly who was writing everything towards the end. You know, it was like after we looked at everything, but somebody was pretty curious about LGBTQ topics like sex and things related to that. There was also an interest in like traditional stories. So like how traditionally was sexuality and sex taught. And I think that a lot of community members and youth are interested in that, and being like, how were these lessons shared traditionally before colonization? Because I think my own personal view is, I think that there has been some shame and stigma around sexuality and sex that isn't a traditional belief. And talking about healthy relationships, what is a healthy relationship? So wanting more information and education on sexual health, and then also consent. So that was something we had after the summary. After the 10-page, I wrote the 10-page summary, I shared it with community members as well. So I shared it with one or two parents, and then I shared it with two youth. And I said, I want you to read this, and I want you to tell me if we missed anything. And one of the youth is like, I don't see anything in here on consent. And I said, yeah, we should add that in there. I think that's really important. And I think that it's really important that when you're doing community work, that you're going back to the community and you're asking them, like, does this sound right? Is this an accurate reflection of what happened or what was said? And then we talked about barriers to access. So kind of like lack of knowledge of how to do that, fear of what people will think, also like transportation. So I think one of the good things about the schools in Minneapolis is that you are able to get sexual health care services from your school nurse, which is interesting because I think some of that is being complicated by COVID. So, and then lack of time. So youth not really having the time to do that. So this was a part of the parent group. So who do you want your youth to get sexual health from? So parent, they thought that themselves, a doctor, an elder, health class. So there was some similarities and differences between the youth and parents. So very similar questions were asked in each group. So please take the time to review that. Please ask questions. So what barriers or challenges do you have when talking to your youth about sexual health? So fear. So they don't know what their kids are learning some of the time. Some of the youth are disengaged. So, you know, it's not uncommon for youth to like want to hang out with their parents, talk to their parents, be cool, you know. So, and then also they're being influenced by like their peers, media, social media. And then also parents just being uncomfortable. So not really knowing how to do those conversation starters or ask questions. So that my parents group or my parent circle that I do kind of helps get parents ready or how to like start conversations or ask questions. So them and then also like not being able to answer questions that their youth might have because they just don't know. And then safety, and then knowledge of self-love and relationships. So those were just some of the the barriers and challenges. And then what resources or information would be helpful. So parents need more sexual health education. So that's part of like what I do in my group is I talk about the sexual circles of sexuality and kind of like some of those basic things. So support systems and groups, traditional Native American teaching. So that's like one thing is I try to do is incorporate cultural teachings any way I can, increase parent involvement, and then conversation starter tips. So this was like, when you think about these listening sessions, like how does that inform like the sexual health video? So what we learned is that they wanted them to be educational, clear and direct messages, a positive message, removal of fear-based teachings, the use of fun and playful infographics, visible Native American images, people and voices, and then humorous. So humor is really important in our community. I know, yeah, I think that it's just used in a way for healing in a way. So I think it's extremely important. So then we started working with, before I move on to the next slides, we started working with Red Circle. So Red Circle is a Native-owned marketing company. So we took some bids out and we decided to work with them. We invited them to the listening sessions to hear kind of that, just to be in that space and that environment to get a feel for the community. And then we also gave them the listening session findings and was like, this is kind of what we learned. And then they came back and they developed these mood boards. So this is like what was developed by Red Circle, and it's like, this is kind of what we're feeling. And I feel like this is a pretty accurate reflection. We first thought that we were going to do 3 shorter videos, and then we ended up doing 2 slightly longer videos. So the videos are a little over 5 minutes. I think ideally they would be about 3 minutes, just because the attention span, but they were so well done. I really liked the videos a lot. So we started moving into this marketing collateral and video production. So developing the ads, and then also, so what had happened is now we moved into this phase where I started recruiting community members to be interviewed for the video. So I ended up recruiting 13 community members, and they all identify as American Indian, and they're either youth, so there was youth in the videos, IHB staff, we had professionals in the community participate, and then also parents. So a couple of the professionals were worked in like sexual exploitation and is a safe harbors, works in safe harbors, which is part of that preventing sex trafficking. And then we had another male indigenous or native doula. So there's not very many male doulas, but he's one of the first American Indian male. I think he's the first American Indian male doula. So I thought that was really cool. And he shared a lot of really, there was so much content in these videos that didn't make the videos at all. And a lot of it was just so good, and we didn't have the time to put everything in there. And then we had parents as well. So parents participating. This was happening right at the beginning of March, and I think it was like March it happened, right before COVID went on lockdown. So, and then we also unfortunately had lost half the interviews, and we had to refilm over, I think like 6 interviews. So it was really, we filmed that Friday, and then pretty much everything went on lockdown that next week. So, and then during COVID, which was nice, I got to like review the script and work on the script, where it was like our education had slowed down here, and we got to stop and review the scripts, there was a lot of, I mean, it was like 13 interviews, and each interview was like 30, 40 minutes long. So it was a lot of reviewing. And then we went into this like marketing collateral phase. So I just want to talk about like these postcards. So these were flyers, postcards, and then also we placed them throughout the community. But even finding the male and the female for these ads was pretty difficult, because the marketing company, Red Circle, you know, they had access to these like stock images and they have access to these files, but a lot of the pictures before were people with very ambiguous national race or ethnicity. So I was like, okay, we need to get like the most Native American looking people, because I really felt like some of them were just not quite right. A lot of them looked a little bit more Hispanic or Asian, and but I felt like these are perfect now that I look at them and they go together. So I'm really happy with these two. If looking back, I wish that we would have photographed community members, but I also feel like it's hard because this is an ad for STD screening and birth control and sexual health education. So you need to find the right community member who's willing to put their face on that, because you know, it's just still shame and stigma. So I would want somebody to be ready for that. If there was like, you know, I wouldn't want them to be uncomfortable, but they turned out great and I really liked them. And we made, so here is this is on Lake Street over in the Longfellow area. So here's like a bus stop of, and then we got them, we advertised in the Circle newspaper. So we put money aside to advertise for a whole year. And I think we're doing like every other month. So the Circle newspaper is a local American Indian newspaper. We also advertised on social media and had a release party on social media. We were going to have a big event here, but weren't able to because of COVID. We used the listserv, bus shelters, and then we have the interior rail cards. So inside buses, they have these cards that you can place in there. And then we had Good Health TV, which is it's like a closed circuit TV system that you can put in your lobby. So our videos are running in our lobby through this Good Health TV that we use. And then like, how are we measuring all this? So looking at our reach. So it's important for us to measure this because it's partly, we need to do it for our grant, but it's nice to know if we're making an impact. So the reach, we're looking at social media reach, and then we're also looking at the reach of the imprint of each of our the bus shelters. And then also looking at our clinic visits. So looking at our STD testing rates and our birth control prescriptions. But that's really hard because now we're in this cycle where we're in COVID. So how do we measure that when we're, you know, we're doing a lot of virtual visits here. So, you know, it really kind of, we're going to do the best we can to measure these visits. And I always try to remind people that we're still here, and that if you need an STD test, call. We will accept you to come in. And then we're also refilling birth control. And then if somebody does need an IUD or an implant or a depot shot, like, we will see you. We can get you in here. We're taking precautions in the clinic where we're not letting people in who, you know, don't have an appointment. We screen people in the vestibule before they come in. So before I wrap up, I just want to say miigwech to everybody who helped me. I think that I couldn't have done this work alone. I also want to acknowledge the knowledge holders, the American Indian community members. All in all, I think we had over 40 community members participate in this work. My supervisor, Lois, Brittany, who was our health program support tech, but now she works in Indigenous services here. Liz Wenzel, who is no longer with IHP, but I was really glad for her to help to take notes. Technical assistance by Khadija, Emily, and Lisa, and then facility use, so acknowledging the Division of Indian Work for letting us do our pilot there, and the Minnesota Indian Women's Resource Center, and then also the Urban Indian Health Institute, the communication team who helped me put together the summary of findings. And I left 7 minutes for questions, so I know that was a quick run through, but let's see.
Thank you so much, Delilah. This was wonderful. You are a force. You're just doing so much and a really important work. So thank you.
Thank you for listening. I'm so happy that there's a lot of interest around this work because it's really important to me.
Mm-hmm. Yeah. If folks have any questions, please put them in the chat. I'm not sure if it's exactly a question, but would you address using STD versus STI?
Yeah, so a lot of the times the term is used conversely, so you can use either or. A lot of the ways that I like to think about is when you talk about a sexually transmitted infection, it's kind of that initial, you're getting kind of like contracting a specific virus or bacteria where that's the infection, whereas a disease is more of a progression of it. So that's the way I like to think about it. Ellen, do you have any comments on that?
Yeah, I also work in the field of sex ed, for those of you who don't know me. I think a lot in the field, a lot of like first like interactions people have with information or on a lot of external materials, folks use STD a lot because it's more commonly known. And as it's more commonly known, there's sometimes more explanation needed when talking about sexually transmitted infection or STIs, but it can be, yeah, it's often interchangeable.
I agree that like a lot of times people are more likely to recognize STD, but I've had people be like, what does this mean? So, you know, it's really important just to be explicit about what you're talking about. So,
yeah.
Are there any other questions?
So I guess question I have, you've collected all of this information and you used it in this campaign. What are the next steps? Like, are you thinking of developing your own curriculum? Like, are you starting to think of new programs, you know, with all the time that you have?
So I think one of the biggest things that we learned from the listening session is that we ended up creating a healing space for people. It's not uncommon for me to be teaching a class and somebody to share their sexual abuse or sexual trauma in the class, which is like when I first started was really hard for me because I'm so connected to my community that it's emotional. So I think about the things that we learned from the listening session and like, how can I implement the things that I learned where I'm creating space for people to heal. I'm creating space for conversations about sexual health. So like I'm incorporating this in my work. But also when I first started this work, I was really hesitant because I was like, oh, you know, the community might not be ready for this. There's going to be some hesitation. The elders might not like this. And I don't know if anybody is familiar with the American Indian community, but our elders are really held in high regard and respect. And also our elders kind of reach elder status at an earlier time than like mainstream Western kind of world, because part of that is like our life expectancy is not as long, but there's also just like, so I thought there was going to be some pushback, but I haven't gotten the pushback that I thought I was. It's being embraced and being embraced a lot. So I was really hopeful. I am not, I hope at one point in the future with my work in grad school that I can focus on like developing a curriculum, but I have also been doing some consulting work for the Division of Indian Work, who have a LIVIT sex ed curriculum that's American Indian specific that was developed here in Minnesota. So they're updating their curriculum, and I have been kind of asked to do some consulting work, but before that, like they asked me to review their curriculum. So I've kind of been helping them do that. And I hope one of the things I do in grad school is I explore how can we incorporate traditional knowledge into sexual health. So that is like one of the things I want to do, but I also have an interest in research because I have a research background. So I'm also doing some HPV research. So I don't know what I'm going to be doing in a few years, but I bet it'll be either some program development or I'll go back to research. So, I mean, we'll see what happens.
Yeah. We had a question about how our peer educators supported in carrying out sexual health education in light of the constraints related to COVID-19.
So I don't run peer educate, like, I guess I'm an educator and all of my education has been virtual. So I did a virtual summer camp, which last year was 8 days in person, an hour and a half. I fed breakfast, lunch, and we had cultural speakers come every day. So it was like 4-hour block. It was great. And it wasn't even enough time. So with everybody doing virtual learning, I cut down the time because I don't want kids to get burnt out. It's all being done virtual. I have been asked to do one in-person training and I'm doing that on Friday, but we're taking a lot of precautions. Like I will be masked, everybody else will be masked, I will wear goggles, we'll all be practicing social distance. It's in a very large room, only 10 people are allowed per class. So I'm gonna see how it goes. To be honest, I'm a little nervous, but our American Indian youth and adolescents they're struggling because of the lack of content.
Yeah. Well, there's a lot of thanks and appreciation for you and your work in the chat, so I hope you get to take a look at that. And I just want to echo, this was wonderful, and on behalf of all of us, we really appreciate you taking the time to share all of this with us. I think everyone has learned a lot. I know I have. For those of you who are familiar or not familiar with MPHA, there's a lot of ways you can engage with us. We're going to put some links in the chat to our website. Please follow us on social media. You can always email membership with questions, concerns, interests, and how to get more engaged. If you or someone you know is interested in leading a presentation, get in touch with us. I think an unintended benefit of doing everything virtually is we have so much space and capacity to do events virtually. So we really want to be highlighting the awesome work people are doing, like what Delilah's been doing. Yeah, so keep an eye out in your emails for other MPHA events. I think the next one coming up is our first policy forum, which is on environmental justice, I believe, in November, just in a couple weeks. Yeah, so thank you so much, everyone. Thank you, Delilah. I'm gonna clap audibly so you can hear it.
Thank you so much, everybody. I'm so glad. I'm reading through the comments right now, and I'm so glad everybody came and joined me, so.
Yeah. Enjoy the snow, everybody. Have a wonderful day. We'll see you later.
Thank you.